So if you were getting a full arch done on yourself.
So if I'm choosing who I'm going to, if I got to choose, number one, I'd always go with the specialist because their training and education and their experience is superior to anybody else, bar none. That's not debatable. Someone who has board certification is a big deal. I say that because of you have to meet a certain national level of education and level of expectations, and you have to maintain that too. That means you're staying current. To do that, you have to stay current with everything. So doing it, I'm adamant about general anesthesia, because if you're under general anesthesia, we're not worried about the patient per se, swallowing, fluid going down the throat, in pain, all the disturbance you can get from doing local anesthetic or sedation. The patient essentially can have what we call rodeo anesthesia. Meaning they're all over the place, they're uncomfortable if you just try to do sedation or local.
What's the difference between those?
So,
anesthesia.
So IV sedation would be just literally placing an IV in there and then giving you what we call Versed and fentanyl, just almost like having a couple glasses of wine. You're still able to feel things, and you feel pressure and a lot of other discomfort, especially getting anesthetized with local anesthetic. You'll feel that if you're under conscious sedation. Versus a general anesthetic technique that's without an intubation tube, that's still dangerous, and it's not as thorough and not as predictable anesthesia-wise. But the surgeon's going to do a lot better surgery, guaranteed. Every surgeon you ever talk to say, which would they prefer? They're definitely going to choose a patient that's completely under general anesthesia, because you get better control of everything. You're going to irrigate more, you're going to do better surgery, you're going to get better results, long-term and short-term.
Now, do you do that as a surgeon?
As a surgeon, I do general anesthesia on every case that I do on all fours, for sure.
Okay.
So, and then, so my anesthesia is my number one criteria. Number two, board certified surgeons, and then the prosthodontist. So you're working with all specialists. I work with a lot of general dentists. There's some are outstanding. They're definitely out there. I'm not going to debate that. They're definitely there. But if you really truly study it, you don't know who they are. There's no standard amongst dentists. Who's keeping them accountable? A lot of them go to weekend courses, in-state, out of country, to get a little bit of education, then go practice on the patients. Where a specialist is already pre-trained to do all this, knows how to handle bone, knows how to handle soft tissue, knows how to handle grafting material from the onset. And so there's a massive advantage to that.
So you want, from what I want to recap, you want a prosthodontist for sure, an oral surgeon, board certification is very important. And then do you want your anesthesia, like you are an oral surgeon, would you rather be having their oral surgeon handle that, or would you want an anesthesiologist?
It's a great question, because I did general anesthesia myself for many years. I have a license to do general anesthesia, so I did my general anesthesia for probably about 5 years or more. Just got to the point where it's just not efficient. It's not as good as if we have an anesthesiologist taking control. That's all they do every day, versus now all I get to do is surgery all day, every day, which is perfect, because that's what I'm best at. It's not that I'm not good at general anesthesia, but it's you have to pay attention to both sides, and then you're distracted when you're doing surgery by paying attention to the anesthesia as well.
And how important is a dental assistant?
An assistant is mandatory. You pretty much can't do this by yourself. You need retraction, suction, and you need a team approach, period. So we typically have a circulator, 2 surgical scrub techs or dental assistants, anesthesiologist, prosthodontist, and an oral surgeon is typically the team that we have.
So that's like 6 people.
Yes.
So do most offices give you 6 people?
No, not in dental offices. They're going to pretty much have 2 people in the room, period. So for most of them, they're going to have the dentist and the assistant, and that's pretty much it. They may have a circulator as possible.
Why?
Cost, experience, and education. They just have never been around it, or a lot of people are motivated by financial means, so you have to be careful there, because there's a lot of money in dentistry. And so I grade people out pretty harshly. Majority dentists are anywhere from a 75 to 85%. Only less than 5% of the dentists I work with do I grade out higher than a 90. And so.
And you're a professor who works in full arch.
I work with a lot of different people, and I teach it, and I encounter that extensively. It's not that they're bad people. It has nothing to do with being a bad person. It has to do with their skills and abilities and their experience. Most people, experience is everything, and they lack experience. So that's probably the biggest issue.
Thank you.
Okay.
Thank